This is Dr. Mollie James, and this is my recorded testimony in support of HB12, the Jeff, Dave, and Angie Patient Right to Try Act for the Ohio State Legislature. HB12 is a bill that must be considered and passed to protect the rights of Ohio citizens, both patients and physicians, from the gross injustices that occurred during COVID and since 2020. The bill does three main things. First of all, it protects the patient's right to pick up prescriptions and prevents pharmacists from blocking that action. It protects physicians from having their licenses threatened due to off-label prescribing, and it protects a physician's right to free speech. During the COVID pandemic, we saw a violation of all three of those, which resulted in hundreds of thousands of lives lost, both in the hospital and at home, and a $1 trillion propaganda campaign coming from bureaucrats and people with financial stake in the game replaced individual patient advice, the doctor-patient relationship, and common sense management. We need to never let that happen again, and HB12 is a critical step to making that happen. During COVID, we had patients who had shortness of breath, and when they went to the pharmacy to pick up prescriptions, if they told the pharmacist it was for asthma, that prescription was filled. If the same patient told the pharmacist it was for COVID, there were instances where those prescriptions were denied, despite the fact that it would have treated the underlying condition. We also saw a number of physicians like me who saw the discrepancy between the narrative that we were being given and what was happening right before our eyes, and we began to speak out. When we did so, we were threatened by our employers, fired, as I was. We were threatened by our professional organizations that our board certifications were in jeopardy, and we were investigated and punished by medical state licensing boards. Flash forward to 2025, and all of the advices that we were given at that time have now proven to be true, and we have been vindicated of any wrongdoing. In fact, thousands of studies have been published that support what we were saying, that early treatment was critical, and there were other inherent dangers, and we were going down wrong roads. Please consider supporting HB12 to protect patients' rights and physicians' rights, so if this ever happens again, we can continue to give excellent individualized care to patients, and physicians can do so without threat to their livelihood and their professional ethics. Thank you.